Good afternoon and welcome to Comcare's Safe Work Month webinar on supporting psychological safety through consultation. Wherever you're tuning in from, thanks for making the time to prioritise this conversation and invest in safer, healthier workplaces. Before we begin, I'd like to take a moment to acknowledge traditional custodians of the lands on which we're virtually meeting today. I'm joining you from Canberra, so I'd like to acknowledge the Ngunnawal people who are traditional custodians of the lands that I'm meeting on today. I'd like to pay my respect to elders past and present and to acknowledge the contribution that they've made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander people who are present and acknowledge your ongoing connections to skies, lands, waters and culture. So Yuma Yumalundi. Which is hello and welcome. We've got a full agenda today with 3 short presentations over the next hour. My colleague, Tom Dawson, will be joining me first, and we'll be beginning with a discussion about psychological safety and consultation and encourage you to participate in the discussion. We're also really pleased to be joined by Shannon and Claire from the Australian Public Service Commission, who will be sharing a presentation about Speak Up culture. And last but definitely not least, we've got Diane and Courtney from Telstra who'll be talking us through a case study in their organisation. We're going to have the Q&A open for you to be able to submit your questions throughout the session. So I'll be asking you, the audience, some questions and encouraging you to share your thoughts, to add your value to help make today's discussion as engaged and as interactive as possible. I ask you to keep all questions and comments respectful and on topic. I understand that some organisations may have restrictions on their systems which may not allow you to contribute to the Q&A. So if you can't access the Q&A or prefer to just sit back and listen, you're welcome to consider the questions in the context of your role and your workplace. Please note, we won't be addressing questions related to specific workplace matters or circumstances. However, if you are in the Comcare scheme, then you're more than welcome to contact Comcare's Work Health Safety Help Desk for assistance with some of those questions, and the contact details are being shown on the slide now. The session's primarily intended for participants who are operating under Comcare's Work Health and Safety jurisdiction. If you happen to be covered by a different safety regulator, such as a state or territory scheme, please just make sure that you confirm any guidance or advice that it's relevant to your circumstances and your work health safety jurisdiction. And lastly, the session is being recorded and will be made available on our website in the coming weeks. So if you'd like to rewatch or share with your colleagues, you're more than welcome to do so. Today's presentation, as I mentioned, will be discussing psychological safety. It may involve discussion around mental health and psychosocial risks and hazards and workplace culture. And some of those conversations that are shared might have an emotional impact. And if that's the case for you, we'd really like you to take care of yourself. So feel free to leave the webinar at any point. And if you do experience distress or find yourself needing some extra support, please reach out to a trusted person, your EAP provider or another support service such as Beyond Blue. There's some links and some contact details that are now being pinned in the post and on the screen now. So I'd like to now bring in my colleague, Tom Dawson. And Tom's the Director of Regional Operations for the South Australian and Northern Territory region. He'll share his experience, expertise and insight into the discussion. Welcome, Tom. We're really looking forward to hearing from you.
Thank you, Andrew. Excuse me, and good day, everyone. It's really good to be involved in this topic. I think as a regulator, we see firsthand all the fallout when employers fail to consult or consult in a tokenistic fashion. And this can lead to a complete breakdown of communication and trust at a workplace. And it undermines the intent of the legislation framework and specifically the consultation requirements. So looking forward to being involved. But the key message, simply put, good consultation leads to better informed decisions and improved worker morale. Thanks, Andrew.
It's Tom. So this webinar is taking place during Safe Work Month. And this year's theme is safety every day. Sorry, safety every job, every day, which really relates to everyday risk management. And an instrumental part of risk management, of course, is consultation. In order for consultation to be effective, workers need to feel empowered and they need to feel safe to raise concerns and to participate actively and contribute to the process. And this is what psychological safety is in concept, and what we're going to be exploring today in further detail. We acknowledge that there's different levels of understanding and experience within the audience today, so make sure we're all on the same page. We're going to touch on some definitions of the concepts to begin with. So it's really important to understand that psychological safety and psychosocial risks aren't the same thing, and to differentiate the two concepts. They're not interchangeable, but they're definitely related. Tom, can you help us explain briefly what's the difference between psychosocial risks and psychological safety?
Yep, certainly, Andrew. I'll do my best. And as you said, these terms sound similar, and they are related, but they are different. So when we're talking about psychosocial, that's the social hazards and risks, these are factors in the workplace that may negatively impact or indeed harm mental health and well-being of workers. And for that, we think about things like high job demands, poor organisational support, bullying, harassment, job insecurity, fatigue, and even intrusive surveillance. Whereas the psychological generally refers to a person's individual thoughts, feelings, and mental state, whereas psychosocial refers to the interplay, the connection, so to speak, between an individual's mental health and their environment. And in the context today, that is the workplace. Bear in mind, a workplace can be anywhere a worker goes. So when we talk about psychological safety in a workplace, this is more about the individual, team, or cultural conditions where people feel safe to speak up, share their concerns, mistakes, questions, and share ideas for improvement. As most people would know, recent changes to Commonwealth work health safety legislation, PCBUs or employers have more explicitly called out the requirements are more explicitly called out of the way they should manage psychosocial hazards and risks.
Yeah, great. Thanks, Tom. And of course, we're not going to be going into too much detail on specific hazards today, but Comcare's website and our free learning management system has got more information and guidance around hazard and risk management and a range of psychosocial hazards. So they're really worth checking out if you're after more. And you might notice that in the Q&A, we've added the first question for you, the audience, your input around what words come to mind when you think of a psychologically safe workplace. And while we're waiting for some of those responses to come through, I'm happy to kick things off. As we talked about, yes, psychological safety, it's the environment or the cultural conditions that enable people to speak up. And so that is really that sense of being seen, being heard, being respected, as opposed to being ridiculed or judged, perhaps belittled or shamed when people are or humiliated, or maybe some negative humour or sarcastic responses to some of the things. And I can see, not being blamed when people are speaking up. And again, the no blame culture. So, it's nice to see that being reflected in some of your comments. So we'll talk about consultation not being just a legislative requirement, but it's also a critically important part of the risk management process. Tom, can you give the audience a bit more of a quick refresher on how does genuine consultation support workers and a psychologically safe workplace and culture?
Yeah, certainly, Andrew. And just to reiterate your point, consultation is actually a legal requirement in the work health safety space. It involves actively seeking input from others before making decisions. It's not just informing people, but genuinely involving them. But what does genuine consultation really mean to your question? Really, it isn't just a tick in the box exercise. It's not seeking input after decisions have already been made. It's about creating an opportunity for real influence where feedback can actually shape outcomes. It's about giving workers voice, giving them agency, and where they are actively involved in identifying hazards and the risks associated with them and shaping solutions. It's involving the people doing the work. But for it to be effective, it relies on open two-way communication and transparent dialogue. It requires respect and inclusion, and it should welcome diverse perspectives. Lived experiences should be welcomed and considered as well. So genuine consultation is there to help increase the understanding of the work environment, with conditions, the processes as they really exist and as the work is actually done. And this is compared to, this is like considering real world conditions. So rather than having a policy or procedure, how do you account for time pressures, customer issues, system constraints, and fatigue? They become examples. For example, so you're only really going to get that from the workers doing the work in that environment. And what it enables a collaborative problem-solving approach. It builds ownership, it builds accountability, and the confidence to speak up without the fear of negative consequences. And that's very important. But doing it well does require the engagement of leaders, be that through direct sort of participation, demonstration of support, and showing that they're engaged in the process. As we said previously, not tokenistic. Meaningful consultation can really help build the trust between workers and management, reinforcing, the culture of where safety and well-being are prioritised. But what we're focusing on today is how consultation can support a psychologically safe workplace. And this can happen within formal consultation frameworks, but also takes place with every conversation about work at the workplace. It's ongoing.
Thanks, Tom.
And
yeah, there's lots of comments that have come through which really reflect what you were talking about there. People mentioning inclusiveness and no blame cultures, workplace policies being applied fairly and consistently, that sort of supportive recognition that's in there. Yeah, so that not fearing social interactions and being free from bullying, harassment, and the like there. We also received quite a few questions that came through the registration process around what consultation is and what it isn't, and what are some of the examples in different contexts and the like. And so I want to pose some of those questions to the audience and create a bit of discussion around that. And while the answers are starting to come through, it'd be really great, Tom, to hear from you about some of the considerations PCBUs need to have when consulting with workers.
Yes, Andrew. Look, I think it's important to note that there's no one size fits all in relation to consultation. It needs to be adapted and appropriate for the issues, the circumstances, and the work groups involved. You need to know your workers and how the best way to communicate. You need to consider things like, does the issue or the circumstance affect the whole organisation or a specific work group or team? Specific risk profiles, different roles and types of work that takes place. I suppose that's a targeted approach. We don't want to leave anyone out. We also don't want to overload people's stuff. They're not engaged. It's not relevant to their work. There's also different types of workers: part-time, casual, contractors, shift workers. You've got to account for that, as well as workers who may be culturally and linguistically diverse. Language, cultural sensitivities, and disabilities should be considered. So you've got to be inclusive, I suppose, is what we're getting to there. We also need to consider different options for participation and understanding how your workers and your colleagues want to participate. Some want a quick read at a high level, others will want a more depth version, and some preferably in person. These preferences can be individually led, but also may be impacted, and we've got to acknowledge this. I think the number is up to 5 generations currently in the workplace, which may require different approaches. So it's not a one size fits all, as I said. The consultation needs to be accessible and it needs to be genuine. And the role of managers and local leaders, like supervisors, is essential to contributing to psychologically safe workplaces. Got to know their teams, identify behaviours and actions where there may be a need to check in. In summary, as I said, rarely does one size fits all. So we include a range of approaches: direct, formal channels, town hall meetings, surveys, feedback forms, etc., and some indirect channels, noticing changes in behaviour, looking at HR data, observations, creating space for honest and open discussions.
Thanks, Tom. And yeah, so yeah, a great comment about in there about sharing plans early enough for them to be still
Yeah,
changed and adapted, and giving enough time for people to engage as well as both conversation and opportunities for anonymous feedback, as well as looping back to address the issues raised. So it seems I might have already almost seen some of the stuff we're going to be talking about already, which is terrific. So yeah, as you said, yeah, it's not a one size fits all approach. It's about that mix that matters. Um, Clearly, using different approaches to also deal with a major organisational restructure. Uh, Compared to maybe a process redesign for a specific team that only affects a small part of the work group. So having it both sort of contextualised to the circumstance. Also keen to kind of talk about, what are some of the key avenues to having safe avenues for workers to identify issues and areas of risk and understand their hazards and controls. So on consultation, Tom, I'm keen to hear sort of some of the threads or areas that the inspectorate, the WHS inspectors across Comcare are seeing when they engage with workplaces. Are there some common themes that sort of come up?
yeah. Thanks, Andrew. It's quite timely to be covering this now because our 2024-25 regulatory or proactive regulatory program for Comcare inspectors, so that ended in June this year, was focused on the three C's, which was consultation, cooperation, and coordination. And we proactively reached out to 200 PCBUs or employers within the Comcare care scheme. And positively, we found overall that almost all the PCBUs were able to demonstrate having the policies and procedures around consultation and issue resolution. There was an opportunity for improvement with demonstrating how this looks in action when implementing or responding to a real life issue. We said work as imagined versus work done. So the real life pressures that come in, that's all very well having the compliant policy and procedure on the shelf, but how does it actually work in the workplace when there are competing demands, fatigue, shifts, as we touched on earlier? So it's making sure it's fit for purpose and reviewing it and getting that two-way flow of communication. But more broadly, we see through our work health safety concerns, complaints that come through to our help desk contact centre, that there are gaps in understanding the issue resolution processes in workplaces, when and how to use that. And quite often that's in relation to a breakdown in communication or consultation. What I would say there is that if an individual or a party comes to Comcare to seek issue resolution assistance, the first thing we look at is how has that been addressed within the organisation. They need to go through their internal procedures first, and it's quite often there where there's a breakdown or a misunderstanding of expectations. So recognising that as a result of those that proactive work, we're now exploring doing a further webinar on that topic to support workers and PCBUs understand the processes of consultation and what happens when it needs to be escalated and what sort of what things need to be done before we seek regulator assistance.
Okay, great. Thanks, Tom. Yeah, that I'm sure will be really helpful. Yeah, the next question that we've got in there is around barriers. What sort of barriers you as the audience have come across when doing consultation, and what might have made it easier. And while those responses are coming in, Tom, have you seen many barriers? And what are some of those common barriers, and what might be sort of some approaches to work around those?
Yeah, barriers and more broadly just general issues. Quite often it's decisions made before consultation. So workers have a pretty good sense or a radar to tell when feedback won't influence their outcomes. It's an afterthought, we've got to do it, so we'll just, do it, but it's tokenistic. A lack of time or resources, consultation is seen as an extra task rather than an integral part of good work and decision making and change management. I think poorly managed communication, unclear purpose, processes and follow-up leads to confusion and frustration. And I was going to say earlier, I think it's really important for managers now to actually sometimes directly call out, this is consultation. Because rather than them having a conversation and them believing that was consultation and the workers not being clear, call it out. The power dynamics becomes an issue. Workers fear repercussions for speaking out or challenging ideas from above. That's fully understandable. But this could be helped, with managers showing vulnerability, expressing their own concerns, misunderstandings, failings or questions. That can go a long way to increasing as we mentioned, the whole point of this psychological safety for others to speak up. Good leaders leading. So I'd recommend, I think, it's consult early and often and call it out. Involve workers at the start of planning, not just after decisions. Empower local leaders, train supervisors and team leaders to facilitate meaningful conversations and escalate insights. Make it a normal part of the workflow. Embed these consultation into regular meetings, safety checks and planning sessions. Use multiple channels. No one size fits all. There's survey forms, check-ins, observations, as well as formal and informal methods. And reinforce that speaking up is valued and protected, especially when raising concerns. But be sure to close the loop, I think. So not everyone will know that. Really be clear about what when you're consulting, and show how the feedback was used and explain why certain suggestions were adopted and conversely not adopted.
Thanks.
Hope that helps.
Yeah, that's really helpful. I know that time is drawing short on this section. We have a number of questions that came through the registrations and keep getting asked around how do you manage consultation fatigue, and can you actually consult too much, and can that turn people off? And I'd love to hear about the audience thoughts, but also yours, Tom, approaches that you've seen that sort of help cut through that sort of consultation fatigue, or when it's just the same process done over and over again.
Yeah, fully understandable, and have seen that often when you're included in stuff that maybe not affect your work group, or it's just overwhelming at busy periods. So yeah, consultation can sometimes feel a little bit onerous with formal processes if it's not managed correctly, but sometimes novel or less formal approaches can really help the engagement with the workers and cut through. I think something I recall from a previous transport network forum, I can give that an unashamed plug. We had a session there presented by Linfox, and that was an initiative they used to engage workers in managing risk and hazards at the workplace, and they call that the 4Ds, and asking the 4Ds at workplaces, and this is every worker at the operational level can actually make a change. It sort of cuts through some of the legislative stuff. So asking the questions, sort of what's daft or dopey, what's not working or making sense. What doesn't make sense about the work you're doing? What's difficult? What tasks do you find difficult or hard to do well? What's different? What has changed or is changing relative to how things are usually done or should be done? And what's dangerous? What feels risky to you about the work you're doing? And I think that's sort of plain English, practical questions that every worker can sort of stop and think about, and then flag it. And it's really just getting that buy-in. I think the point I'm trying to make is as we said, using the initiative to engage people.
Thanks, Tom. Yeah, that's really helpful. I think it's those simple questions and asked in a different way can sometimes really help with cut through. And, the audience has sort of said similar things, not being asked the right questions or too onerous or too difficult questions that take too much time. And also reflecting that psychological safety again, where people have said barriers are not feeling safe, or it might be career limiting if I do speak up. So thanks, Tom. We're now going to go and welcome our guest speakers and start talking about what the APSC is doing. So we've got Shannon Owen and Claire McLean from the Australian Public Service Commission. Shannon's the Director of Capability and Workforce Committee Task Force, and Claire is the Director of Integrity and Ethics Team in the APSC, so the Australian Public Service Commission. Now, the task force supports the Secretary's Board, the Capability and Workforce Committee, fulfil its purpose as a catalyst in driving organisational and workforce reform priorities. and the Integrity and Ethics team supports the APS Commissioner in his statutory integrity functions, including promoting a pro-integrity culture in the Australian Public Service. The task force led a project to develop a whole of APS approach to building psychological safety, and the Integrity and Ethics team provides advice directly to APS agencies and employees on ethical matters. So both Shannon and Claire's teams have been promoting the campaign to build a Speak Up culture in the APS, which they're here to speak about today. And before I hand over, the resource materials, they're primarily for Commonwealth entities and available through the APS Academy, so may not be available to everyone. However, the general concept and the discussion today is broadly applicable to the whole audience. Now, after Shannon and Claire's presentation, we might have a few time for a couple of questions, so feel free to jot anything down and push those through the Q&A. But otherwise, I'm going to hand over now to Shannon and Claire. Welcome.
Thanks, Andrew, and good afternoon, everybody, and thanks to our Comcare colleagues for inviting us along today. My name's Claire McLean, and I'm joined by Shannon Owen, my colleague, and we'll be speaking with you about our recent work on building Speak Up culture in the APS. And before we begin, I wanted to mention that this subject may be emotionally impactful for some people, and if you feel distressed at any point during the webinar, please feel free to step out and come back at any point when you feel up to it. The webinar is being recorded, so you can always come back at another time. If you feel you need support, please reach out to a trusted friend or colleague and talk about how you're feeling. You may also like to seek support through your organisation's employee assistance provider or HR team, or through support services such as Beyond Blue, Lifeline, or 13 Yarn. In today's session, Shannon and I will provide some background and context to the Speak Up Culture project, and we'll explain what Speak Up Culture is and why it is important. We'll talk to you about how you can build Speak Up Culture and introduce the guidance we've recently released to help APS employees, managers, and leaders do just that. We'll finish by talking about implementation of the resources, and we should have some time for a couple of questions. So let's start with some background. In early 2023, the Secretaries Board convened an APS Integrity Task Force to take a bird's eye view of the integrity landscape, identify strategic and operational gaps, and look for opportunities to learn from and build upon the important integrity reform initiatives that were already underway across the service. The task force's Louder Than Words report in November 2023 made a number of recommendations, including recommendation 4 to bolster the capability of the APS to lead with integrity, with a focus on ethical decision-making and fostering psychological safety. Secretaries Board agreed that the recommendation go ahead and tasked the Capability and Workforce Committee to oversee this project. The importance of this recommendation was highlighted by the Royal Commission's hearings and eventual findings that public servants who had well-informed concerns about the operational impact of that scheme felt unable, or they felt they were impeded from speaking up about those concerns internally in their agencies. A lack of psychological safety in those agencies was found to have led to poor program design, adverse operational impacts on the Australians who were subject to the scheme, and workplace and moral harm to staff who were asked to implement it. It was also clear from the Royal Commission's report that this was a more systemic program than in one agency, and the remedy required a considered evidence-based whole of APS approach. So first, we'll talk you through the project and deliverables. We'll talk you through the project and deliverables in a minute. But firstly, what is Speak Up Culture? And you may notice throughout this presentation that Shannon and I will use the terms Speak Up Culture and psychological safety interchangeably. We'll explain why we've switched terminology in a moment. But I wanted to reiterate, conceptually, what we're talking about is the same thing. Speak Up Culture in the APS is based on the academic definition of psychological safety, which, as I've heard already, is the belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes, and that the team is safe for interpersonal risk-taking. As Andrew and Thomas discussed earlier in today's session, in the Australian context, psychological safety is often entangled with related concepts, in particular psychosocial safety. While there are links between the concepts, they're not the same thing. Psychological safety is about the interpersonal environment. Can people raise concerns, admit mistakes, or challenge decisions without fear of retribution? And psychosocial safety involves mitigating hazards that may cause psychological harm, such as bullying, poor role clarity, or excessive workload. When employees don't feel safe to speak up, organisations can lose ideas, trust, integrity, and performance. And they can also lose insight into concerning psychosocial risks that might be bubbling away under the surface. While distinct concepts, psychological safety enables better psychosocial risk management, as people are more able and likely to raise concerns about the presence of psychosocial hazards if they feel it's safe to speak up. So, to address this confusion in terms, we've replaced the term psychological safety with speak up culture in our project deliverables. And we've worked to differentiate this objective by being really clear in our resources about what speak up culture is and what it is not. So now let's drill down into speak up culture a little bit more. This slide shows the kinds of actions you could expect to see in teams that are built on a speak up culture. For example, sharing of ideas, concerns and feedback, engaging in difficult conversations, and a willingness to take accountability. Building a speak up culture requires both leadership and followership, and a willingness to put holistic systems and accountability structures in place to support that culture. An integrity culture doesn't magically grow on its own. While we're still in the very early days of looking at our employee engagement data through an integrity lens, we would also expect to see a correlation in teams that have high psychological safety with high engagement, low attrition, and low fraud, corruption, and misconduct metrics. Through our consultation, it became clear that there were some common concerns and misconceptions around speak up culture, as you'll see on this slide. One of the things that came through our engagement with senior leaders was a perception that psychological safety could be weaponized and used by some employees to avoid difficult conversations. In the materials, we've made clear that speak up culture is not a free pass to avoid difficult conversations or routine work requests and performance conversations. In fact, speak up culture supports these kinds of conversations to be had in a meaningful and safe way. There was also concern that speak up culture could be read as a license for unbounded venting or gossiping. Again, our materials make clear that the expectations about not just speaking, but listening and finding appropriate opportunities to raise issues or provide feedback. I'll hand over to Shannon now to briefly recap what we learned through the project and how this has informed the development of our recently released guidance materials on speak up culture in the APS.
Thanks very much, Claire. So you've already heard that the Louder Than Words report made clear that to lead with integrity, the APS must foster a culture where employees feel safe, supported, and empowered to speak up. This is because speak up culture can serve as a mechanism to prevent and deal with wrongdoing. But speak up culture isn't just about raising problems or calling out bad behaviour. Speak up culture also helps the APS improve performance, build trust, and continuously improve by creating an environment where people can contribute their ideas and expertise, ask and answer questions, and learn from one another. As you'll see on this slide, speak up culture leads to stronger engagement because people feel heard, more innovation, because when we share with one another, we learn, adapt, and improve. It leads to better performance because problems are surfaced early and solved faster. And it leads to improved well-being because fear and silence take a toll. So now to the project itself. We began our project with discovery research, and this really was a critical phase for us. We learned a lot and we referred back to our findings often. Our research involved interviews with HR leaders and employees across the APS, analysis of more than 400 submissions from APS employees. We did a desktop review of existing APS psychological safety resources and literature review of contemporary practice. And we had input from a range of subject matter experts, including our friends here at Comcare. I won't spend too much time on the findings from our discovery research because there were many, but we were able to group them into three main categories. Firstly, define. APS people, and that's both agency reps and employees, were not always able to correctly name psychological safety, but they could describe the behaviours needed to make them feel safe to speak up. Next, guide. We asked agencies to share their psychological safety resources with us. We received lots of really useful information, but most of it related to work health and safety matters or mental health and well-being, and very little actually related to psychological safety. So we thought we'd identified a gap. And finally, measure. It also became clear that the APS had no way of measuring psychological safety and that people felt that measurement was an important part of building it. So now to the project deliverables. At the core of building Speak Up culture are 4 simple practices. We call them the 4 Cs, and they are listen with compassion, show curiosity, speak with candour, and act with courage. Listening with compassion is about care, inclusivity, listening respectfully and considering the impact of your words. Showing curiosity includes being open to new ideas and inviting others to share their views. Speaking with candour might include providing constructive feedback or being candid about your own mistakes. And acting with courage could be about taking initiative to recognise and rectify an issue, especially when it is challenging. We feel that each of the 4 Cs has its own role to play, but it's the combination of all of them that creates the environment for people to feel safe to speak up. So to help bring the 4C practices to life, we've developed 2 resources that are now available to all APS employees via the APS Academy. The first is introductory guidance, which is designed to help APS employees, managers and senior leaders understand Speak Up culture, why it's important, and how to build and sustain it. It includes an optional tool to help people observe the 4C practices in their team, reflect where changes or improvements could be made, and links to optional bite-sized resources to help people build capability in the 4 Cs. We've recognised that for some people there are barriers to speaking up, so the guidance also includes resources to help people identify what those barriers may be and learn how to overcome them. The second resource is a manager playbook, which is designed to guide managers at all levels through the basic principles and actionable steps for building Speak Up culture in teams. It's on all of us to build a Speak Up culture, but managers play a pivotal role in shaping team culture and making sure employees feel safe to voice their thoughts, their concerns, and their ideas. The guidance includes tips to help managers get started, for example, starting by building their own understanding before talking with their teams and planning next steps together. Importantly, the guidance makes clear that managers don't need to tackle everything at once. Taking small steps over time will lead to meaningful and lasting change. And I'll throw back to you, Claire, to wrap us up.
Thanks, Shannon. Like anything to do with cultural change, building Speak Up culture takes time. We've identified and tried to address 3 key implementation challenges. The first is overwhelm. People are busy and agencies are already grappling with a lot of change and expectations. That's why we've made this guidance concise, practical, flexible, and importantly, not mandatory, so that agencies are free to use it in a way that makes sense for them. The second is mindset. Some people may think that this isn't for them or struggle to know where to start. And that's where leadership matters most. When senior leaders model the behaviours they expect from others, change is possible. The third is measurement. Until now, we lacked consistent data and therefore had no way of measuring psychological safety in the APS. So it was hard for leaders to know if there was a problem in their agency. So we've added 4 questions to this year's APS employee census, drawn from a validated scale to effectively measure psychological safety and help agencies track and respond. The questions are, and you'll see these on the screen, people in my work group are comfortable checking with each other if they have questions about the right way to do something. If you make a mistake in my work group, it tends to be held against you, and this is reverse scored. The people in my work group value others' individual skills and talents, and the people in my work group are able to bring up problems and tough issues. APS agencies recently received their census results and now have a data point to consider levels of speak-up culture in their agency and whether action to build it is needed. Where action may be needed, our resources will be a great first point of call for teams to start thinking about making some change and have the conversation. In closing, the Speak Up Culture materials were released via the APS Academy's APS Learn platform to all APS agencies on the 30th of May this year. The project was in response to the APS Integrity Action Plan, as I mentioned. Speak Up Culture enables APS people to uphold the APS's integrity frameworks, including the APS values and code of conduct, by helping people understand their obligations, know how to live up to them, and feel safe to seek support and raise concerns when behaviours fall outside of these expectations. But there are many benefits of Speak Up Culture, including, as we've spoken about, better psychosocial risk management because people feel safe to speak up and raise concerns about the presence of psychosocial risks. We're obviously really excited to see how the materials are implemented in agencies, how they engage with and promote the materials to their staff, and how they are received by staff. We're also keen to monitor our new psychological safety data collection year on year and add it to the range of integrity metrics we already collect. While the psychological safety questions are new to the census this year, we do intend to keep them as an important longitudinal metric that can assist in showing us the presence of integrity, which is always much harder to measure than the absence of integrity. Finally, we've got some contact details there. APS employees can always contact the Ethics Advisory Service, either by phone or at the address on your screen. Thanks, Andrew.
Thanks, Shannon. Thanks, Claire. That was really helpful. That was great. I really like the approach of stepping away from some of the technical language and differentiating, or at least relabeling or rebadging psychological safety with Speak Up culture. We did have a couple of questions that came through, but you've actually answered those questions as we went through the presentation. Things like what specifically can managers or individuals do. So the 4 C's, of course, is the way to go. So curiosity, candor, the 4C, courage, and compassion, of course. So yeah, that's great. So time is pressing on. So we are going to go and welcome our next guests from Telstra. So please join me in welcoming. We've got Diane Barnett and Courtney Beck. Now, Diane's the Business Operations and Senior Lead for Key Contact Centres at Telstra and based in the National Operations Team. And Diane oversees critical operational processes and collaborates across safety and wellbeing initiatives, including psychosocial safety programs. Courtney is a Senior Mental Health and Safety Specialist at Telstra, working within the Safety, Security and Wellbeing team. Courtney leads initiatives focused on psychosocial safety, employee wellbeing and compliance with a focus on operationalising safety and wellbeing programs. As part of her role, she partners across the business to improve capability and foster a safe and supportive workplace culture. As you listen to the case study, we really invite you to consider the following questions. What could you adapt for your own context, and what stood out about how Telstra supported psychological safety? So over to you, Courtney and Di.
Thank you for the introduction, Andrew. It's great to be here today. I do want to just apologise for my voice. I've been unwell and I haven't quite got my voice back yet. So as Andrew mentioned, I'm part of Telstra's mental health and safety team, and I've had the absolute pleasure of working with Diane, who's done an incredible job bringing our health and safety framework to light in some of our contact centres. Because of the psychologically safe culture Diane and her leaders have fostered, they've been able to implement controls and improve job design in a very tightly regulated work environment. So I'll hand over to Diane to speak to you about this in some more detail. Thank you so much, Di.
Thanks, Courtney. Welcome, everybody. As Courtney said, I look after a number of contact centres for Telstra. We have a number of contact centres nationally across the country that support vulnerable customers in times of quite difficult circumstances for the individuals. That puts a lot of our frontline call takers in a position where they're exposed to traumatic events, such as high emotional demands, things they might hear or see, low job control because of the high regulated environments, and the typical nature of the work itself. So in 2022, we went on a journey to understand more about our employees' experiences, what the risks were, what the proactive factors in the workplace could be, and what processes could we build and embed. And those processes that we discovered through that journey, they still continue today, and we continue to build on them. Next slide, please. So our employee consultation process, we really wanted to ensure that we had a thorough and holistic understanding of what employee consultation was going to mean to the business. So we sourced feedback through focus groups that was facilitated by an independent provider. We had a safety climate survey conducted across all our centres that included our frontline employees, our agency, so our contingent workforce, our managers and our subject matter experts. So the outcomes we got from that really identified where we had very strong processes in place and also our opportunities. So that enabled us from those learnings to create wellness plans for all our call centre operators. That program is still in place today. It gets reviewed every year by our employees, and we make any tweaks we need to protect our workforce and continue to collaborate with them. Next slide, please. So what did we learn from consultation? We learned that our greatest opportunity was low job control. And that was due to the nature of the environments and the types of vulnerable customers that our employees were dealing with day to day. Now, that posed a real challenge for us because we had to consider balancing safety with the business needs so that there was no compromisation. So what was the answer? The answer for that was to improve our employee consultation engagement. We had to acknowledge to our frontline call takers that that was something we just didn't do well. We typically, as a business, managers would make the decisions, we'd make the processes, we'd go out and we'd tell them the what, the when, the how, and there was no real, well, can we give feedback? So that was our biggest opportunity and to increase our employee satisfaction. Next slide, please. So I talked a little bit about acknowledging what we needed to do and how we needed to do it. We had to ask our people, we had to listen, and then we had to act. Now that was identified, as I said, through the climate survey. The acknowledgement piece for us as leaders, I think, was the most challenging part. because as business leaders, we often are the main decision makers. So coming out of that cultural leadership was quite a challenge, and being vulnerable, putting our hand up and saying we haven't got it right. So what we now need is to collaborate with you, consult, and improve our processes. We changed that approach so that we could ensure the collaboration was transparent, communication was improving, and that really started to see the culture shift across those Telstra contact centres. So I'll go on to the next slide and talk to you a little bit about how we brought it to life. So we sought feedback from the teams, as I mentioned. We then looked at building a communication and consultation process. We designed that policy document based on feedback from our employees. We distributed it for feedback across those teams, confirming what the timelines were going to be for that consultation period and what the method of that consultation period is. So if you think about a 24/7 call centre environment, especially across vulnerable communities, it's quite a challenging task to do because you've got to get to people overnight shifts, you've got to get to people in day shifts, you've got to get to people in afternoon shifts, and then you've got to try and bring that all together. So the methods of that consultation needed to be quite flexible in order for the business to capture that feedback and build that into that process. So as part of that process, we now have a consultation register, regardless of how small the change is or how large the consultation is. And we record that in there. We record the timelines, we record the audiences we went out to, we record any of the feedback that resulted in a change. And for anything that we can't change based on the feedback from our workers, we will always go back and tell them why we couldn't implement that change. And that in itself, I think, was one of the biggest wins we had around identifying where we could improve as a business and a leadership team. Breaking down those barriers, I guess, between the hierarchy from everything flows down. Everything should be cyclic and it should just go through all the levels across the business. We also created engagement committees. In the past, leaders would run all those activities. They'd publish them, they'd coordinate them, they'd facilitate on the day. We changed that based on our employees' feedback, and we sent out expressions of interest across our teams to generate interest in them actually taking the lead. And then today across those centres, all those engagement activities are run by our frontline employees. They coordinate it, they pick the topic, the leaders support them in any of those activities that they want to do, but it becomes authentic, genuine, and it makes it real for our frontline workers because it's not something that they feel the leaders are telling them they need to do. So our participation rate in those engagements activities is terrific. And if you walk into any one of the centres on a day when there's an engagement activity, you can just feel the buzz in the air, despite the type of calls you might be taking from the general community. Then we decided as well through feedback from our teams that our health and safety committees don't need to be run by leaders. We got expressions of interest out again. We had people from our frontline call taker teams express an interest. We sent them off to formal training externally, and when they came back, they then built the committees through seeking peer feedback and getting engagement that way. That has totally changed the health and safety committees across our call centres. Again, because it's not being led by leaders, it's being led by our frontline employees. And then the last thing, the wellness challenges. I talked a little bit about, we implemented employee wellness plans. We have a positivity wall in all our centres as well, where There's quotes. People put up fun pictures. They share holiday tips. They share recipes. A whole raft of things that aren't work related. But in their wellness plans, we ask them to have a goal that's personal to them. And each month, when they meet with their leaders to talk about their performance throughout the month, we like to wrap it up with them. So we ask them about their personal wellness goal. How have you gone with that this month? And I know when I meet with my leaders, I always share my personal goal as well. It's about expressing, I think, that vulnerability. So as an example, last month I said to my team, I didn't meet my personal wellness goal at all this month. I didn't go for my daily walk. I didn't make sure I was taking breaks when I should have. I didn't invest as much time with my family as I should have. And they're the things that I'm focusing on this month. And that's the stuff that I want you to hold me accountable for as well. So it becomes a very nice conversation at the end of a month. You get to know your employees a little bit better, and it really increases that care level in the workplace. So we continue to build and grow on that today, and the culture shift across the call centres themselves is really starting to become quite evident. It's always nice to see people smile when they come to work. And smile when they're leaving at the end of the day, no matter how tough that day might have been. And I think that's my last slide. I'm not quite sure. Oh, measure of success. So how did we measure that success? We had improved feedback and experiences across our engagement surveys. We can see and feel the increased employee satisfaction. And I mentioned it earlier about the increased participation in the engagement activities, increased openness from our employees to provide that feedback informally, so they don't need to wait for formal requests. We encourage them to give us feedback on the fly, and we take that on board, listen, act. Increased job control, and that provides us with performance uplift. And increased contingent workforces seeking to want to come and work permanently with Telstra. I think that one is probably the most powerful one from a measure of success around the culture and the health and safety and the feel of your contact centres. So thanks, everyone. I'm pretty sure that one is the last slide. Back to you.
Terrific. Yeah, thank you. Really appreciate that. And some really interesting food for thought in there. A great example of a really large, complex organisation that's really taken this on. And I did notice, there's a question in there, which is, what sort of training did you offer your HSC leads? Was it different to HSR training?
No, same. HSR, the 5-day training.
Okay, all right, great. And there's another one, that health and safety committees not led by leaders is really interesting. Was there much arm wrestling as this part of implementing the change?
No, I think the leaders were quite happy to give that control away, so to speak. And it was very powerful for us as a business to have employees go, oh, wow, it's not going to be led by leaders, it's going to be led by us, the people out on the floor, and they're going to pay for us to go to this formal training, and then we're the ones in control. So it was such a big win, and across the centres that we implemented that in, you could feel the shift already. And, it's terrific to feel that and really made the employees feel quite valuable. So, and less work for your leaders. They can concentrate more on supporting their people.
Yeah, great. And I really like that you talked about that adaptive approach that's, empowering workers to take the lead. hearing about how much energy and enthusiasm they have when they're having an engagement session. I also really like that closing the loop when something can't be implemented, actually recognising that we've heard you and we can't, and here's the why behind it. I also thought, Diane, you demonstrated great vulnerability in that and integrity. Being able to say, hey, look, I didn't meet my goals. And that's what we were talking about through the session is about that psychosocial safety or psychological safety of being able to actually say, hey, if I can be vulnerable, you can too. So well done. Great role modelling there. So look, time is pressing on, so I'm going to move us towards the wrap up here now. And there's been so many valuable takeaways here. Tom talked about the importance of genuine consultation and psychological safety as key aspects of managing psychosocial hazards and risk. And there's no one size fits all, but it's about finding the right mix of methods for a given situation. From the really interesting presentation on Speak Up culture and framing psychological safety as Speak Up culture, which I think is very clever as a framework to developing psychological safety from Shannon and Claire. The core of that building Speak Up culture are those 4 simple practices that managers and leaders can use in their teams, and that's that listen with compassion, that show curiosity, speaking with candour, and acting with courage. And that session we just had from Telstra I thought was great, particularly that psychological safety being a cultural foundation, not being just a one-time effort. So it's not just something that's getting switched on during consultation periods like employee surveys, but it's being embedded in everyday practices and the organisational culture. So it naturally flows into all of the processes, and really it's demonstrated in your retention and your recruitment, people wanting to join and people wanting to stay. So that's terrific. For those of you in the audience, it'd be great if you want to post a comment about, what's an idea that you might take back to your team, or how might you apply today's insights to improve consultation in your workplaces, or is there any supports or resources that would help you strengthen psychological safety? Now, in wrapping up the session, I'd like to thank all of you for taking the time and making the effort to tune in and contribute. And a special thanks, of course, to our guest speakers, Tom Dawson, we had Shannon, we had Claire, we had Courtney and Di, for generously sharing your experiences and insights with all of us. If you've got a few moments to spare, I'm going to share some upcoming activities that might be of interest. First of all, Comcare's National Conference is Comcare's flagship event, and it happens once every 2 years. And we've got some exciting news to share. The next conference is confirmed for the 14th to the 16th of September in Canberra. The conference is going to be exploring a people-first approach to workplace health and safety, and more details will be available later in the year. We've got our last Safe Work Month webinar next week, and this one is on designing work design to support psychological or psychosocial risk management. We're also excited to announce that we have an upcoming session on psychosocial risk management, one of our education training sessions in November, and a new training package that's rolling out next month in November as well on understanding and addressing trauma in the workplace. So if you're interested in those, make sure you check out our website and tune in. Before you log off today, we'd love your feedback. So you can scan the QR code on the screen. You can click the link that's pinned in the Q&A post and complete a short survey now. Or alternatively, this survey will be sent to your inbox so you can complete that in your time. It only takes a few minutes, but it really helps us shape future sessions. And if you want to keep the momentum going, make sure you subscribe to Comcare's e-news, follow us on LinkedIn for the latest resources, research and events updates. And as always, if you missed something or you want to share today's insights with your team, the session recording and transcript will be available very soon on Comcare's website, so in the next week or so. We'll send you a link when that's happening. Thanks again for being so engaged with the session. I look forward to welcoming you next time. And in the meantime, take care and stay safe.